when I graduated, when I was a nursing student over 20 years ago, one of the things we talked about in the closing months of our education program, and I went to a hospital-affiliated diploma nursing school, one of the older style schools, not a university or a college. But one of the things they talked about was so-called reality shock. That transition from education to the workforce can be a major shock for a brand new graduate nurse. And I don't think that system-wide we have done a very good job of addressing that. And there's been a great deal of, it's not my responsibility, it's your responsibility, and back and forth. For many years, the educational side of nursing, the nursing schools, the faculties of nursing now in universities have been advocating for employers to take much greater responsibility for mentoring, for internships, for bringing new nurses into the workforce in a smoother transition sort of system. Whereas the healthcare system wants nurses to graduate from nursing programs who are ready to hit the ground running. And that lack of communication between the two sides is astounding in that it hasn't been resolved after all these years, because this is the same stuff I heard in the 80s. It's nonsense. It shouldn't be happening. There should be a lot more coordination between the two. I mean, they're both publicly operated services. It's not like we're talking about, two corporations that don't want to talk to each other. I mean, the healthcare system is funded by the taxpayer, and the education system and the higher education system is funded by the taxpayer. They're both provincially regulated, provincially delivered services in one way or another, and they need to work better together. And it's ridiculous.
Well, and it obviously, it's creating a lot of stress points because for the younger people, I mean, it seems like a lot of this learning is going on as coffee break learning, where it's not structured in such a way that a senior nurse can feel that if they say, okay, I've got to take some time with this younger person to give them some orientation around this particular patient or particular piece of equipment, that's going to be something I'm going to have a problem with, because I'm going to be asked, well, why weren't you with a patient for that?
Well, and that's one of the challenges, is that I remember being told once that nurses eat their young, and then I having now being a senior nurse, having over 20 years in the profession, although I tend to be very supportive of learners, I understand where some of that comes from, because a learner is an increase in your workload. You, especially early on in the learning, later on as they start to learn, they start to actually take up some of your workload for you, and you can actually sit back and relax and watch them do. But early on, a new nurse is a burden on their more senior colleagues. Everything takes longer to do. You need to stop and teach. And if your workload isn't adjusted by management to allow you to take the time, you're going to get stressed out and you're going to start to snap. And you're going to, rightly or wrongly, you're going to not be very supportive of that individual because it's too much. You just can't do both jobs at the same time. You cannot do all of your own work and help them with theirs because you're already stretched to the limit. When you look at the hospital setting, which is where the workload issues are the most acute and the most obvious, those and continuing care. I remember when I was a nursing student, when you went to a surgical ward, a post-op general surgical ward where you had people who were recovering from abdominal operations and leg operations and whatever. 30 beds, a certain percentage of those beds were people who were 3 or 4 or 5 days post-operative, were recovering, were getting better, convalescing, they're getting up and around. And so their actual physical care needs tended to be less. And you had fewer people who were in that more acute early stages of recovery, who were still unstable, they needed vital signs checked more often, they had IVs running and yada, yada, all that sort of thing. Well, all now in today's workplace, all those more stable people who are convalescing are gone, they're home. Every bed is high acuity. The number of nurses hasn't changed from what it was 20 years ago in that unit. And the paperwork requirements are higher. New requirements for accountability, for documentation of care, for and accountability in terms of like fiscal accountability, material accountability, filling out forms for everything just to get a box of pencils. All that sort of nonsense. Computers, you know what, they're a wonderful thing, but they have not integrated into the workplace very well in a healthcare setting. one of the things I remember some information technology experts saying is that computers need to be made to fit the user, but in healthcare, the users are being shoehorned to fit the system, and it's not conducive to getting our work done in a timely fashion. We spend far too much time waiting for the stupid thing to start up and log on, and you just don't have time for that. There's so many things, so many time pressures, and they're just running around hither and yon, and you know, you've all seen that poster that hangs from the ceiling. You know, if you're up to your ass in alligators, it's difficult to remember that your initial job was to drain the swamp. Well, those nurses can't drain the swamp.